Welcome to the On the Pen, the weekly dose podcast, your one-stop shop for obesity medicine news with your host, Man on the Pen, Dave Knapp. Welcome to On the Pen, the weekly dose. This dose is your Tuesday, October 29th, 2024 dose. Welcome. I'm Dave Knapp, Man on the Mounjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, Compound. That pen is what we talk about here every week. We bring you the news in a patient-centric way, right? So what matters to you as patients? And we want to equip you to have more competent and confident conversations with your medical providing team as you treat your chronic disease of obesity, type 2 diabetes, etc. And so I want to jump into basically, I think, what's setting the stage for a very interesting Eli Lilly earnings call, which happens tomorrow on the 30th of October. We will, of course, cover it very closely here at On the Pen. We really can't move forward with talking about really anything right now until we really have a lay of the land of what's going on with accessibility. So let's get right into the news from this week about new savings card dropping for both Mounjaro and Zepbound. So yesterday we posted a blog article at OnThePen.com. Of course, if you're not following OnThePen.com, that is where the best news lies, breaking news in the world of every piece and angle of GLP-1 medications that may affect you as a patient. So if you're not over there, please jump over to onthepen.com and subscribe to email alerts. But we dropped an article yesterday sort of comparing and contrasting the latest 2024 savings card for Zepbound with the new card that is being issued for 2025. Now, right now, there's essentially three versions of the Mounjaro, of the Zepbound savings card floating around. The first version is for people who are covered through their insurance for Zepbound, and really no changes there. They extended that card out until December 31st of 2025. So you're good for the next year if you have commercial insurance that covers Zepbound. You're going to get $150 off per box, essentially, right? And you can fill up to 13 boxes during that time frame with that $150 off. It's going to cap you out at $1,900 and change, enough for you to get the proper amount of fills for the year. Now, the other two cards that are floating around are basically the OG Zepbound card and the new school Zepbound card that dropped around August of this year. For those who have been paying $550 a month, the great news is that you were grandfathered into the change when they bumped it up to $650. The even better news is that if you've been paying $650, you've got that card that expires at the end of December here, you'll be eligible for the new savings card that's going to go back down to $550. So you're going to have a savings of $100 a month. All the terms and conditions are available at Zepbound.com, and you can get access to our breakdown, the daily kicking of the the light behind me. That one was for you if you're watching on YouTube. But the very sort of interesting thing is they've gone back to the $550. And so if you're paying the $650, know that it's going to be a little bit better for you in 2025 by $100. You're going to get that savings card through June. So oftentimes you see this. We've seen this with the Mounjaro savings card as well, where essentially you get a 6-month savings card at a time. And I think really what that is when you think about the price of these prescription drugs in the United States, it's a very convoluted process, right? We've been going through the hearings on Capitol Hill where Novo Nordisk sort of explained how much of the cost of the medication Novo Nordisk is actually bringing home versus what goes to the PBMs and all of that. And it's very convoluted, but essentially and this will come up on the Eli Lilly earnings call in the next couple of days, essentially what number the drug manufacturers are concerned with is their net price. The net price, that's the amount of the dollar amount of the medication that the drug company actually takes home. So in the case of Zepbound and Mounjaro, they're concerned about their net price. That 550 essentially ensures Eli Lilly that at a list price of around $1,100, that their net price is around $550. So this sort of bleeds into what I am sort of hopeful to hear from Eli Lilly in the coming weeks. Perhaps on the earnings call this week, but perhaps maybe a little bit later on. I think that it's going to be very interesting when we hear about Lilly releasing more doses, higher doses of the vials. A lot of people have surmised that the cost is going to continue to go up with each dose. Well, if you look at the net price, this is a cash pay price, and the 5 milligram was priced at $550. If they're concerned about getting their net price, I would anticipate that the upper doses of Zepbound in the vials would hopefully stay very close to that. I believe it's around 550 that they're asking for the 5 milligram vials. So that way your cash pay people are paying what people with insurance and no coverage are paying. Of course, you're probably all going to be better off if your insurance does cover Zepbound. Most of those people are getting the drug significantly cheaper, some even as low as $25 a month. So the net price is something that we'll be paying attention to over the course of the next couple of days as the Eli Lilly earnings call approaches, and I'm hopeful that we may hear about vials on that call. Of course, they increased the earnings at the last earnings call towards the end of the year, and I think that was indicative of some of the things that they made, the changes to the savings card, perhaps some of the vials, even though they said it wasn't. That has to have made some sort of impact. But I'm hopeful that we may hear some more on the vials in the coming days. You're going to need to stay tuned to the channel. We've just a huge week this week between the earnings call, the savings card dropped, and next week being obesity week. So we'll be off to San Antonio this weekend to cover Obesity Week in person. Thank you to those who have chosen to donate to help defray some of the costs of that trip. As I've mentioned before, it will be myself and 2 helpers are coming down to help me bring the most comprehensive coverage of Obesity Week to you next week. So some of you have helped out and thrown a little donation towards OnThePen. Thank you to those who have done that. If you're interested in doing the same, it's scrolling across the bottom. We have Venmo and Cash App. You can also find those very easily at OnThePen.com. But I wanted to tell you about some of the more interesting things that we've seen come out of the news in the last few days. This past week, we saw that Novo Nordisk had made a move to basically add semaglutide to this list that the FDA has. This list is called the demonstrable difficulties for compounding. And essentially what the bottom line of this list is, and I know that you've probably caught other videos that I've done on this, the bottom line is if the FDA would agree that semaglutide is indeed too difficult to compound, I think this is a really, kind of like a Hail Mary, as they say, on Novo Nordisk's part. But if they were successful in gaining this, and here's a copy of the letter, you can check the full blog article out at onthepen.com and read that whole thing there, as well as a slide deck put out by Novo Nordisk that sort of laid out their case, excuse me, for adding this to their list. But essentially what this would do is it would make it illegal to compound semaglutide. They're making a case that the manufacturing of the active pharmaceutical ingredient is different in the compounded versions, which is true. Novo Nordisk uses a recombinant process, basically extracting the peptides from yeast. And the API of the compounded versions is more of a synthesized process. Now, interestingly enough, a little bit later in the week, after we had an interview with Mr. Scott Bruner on the Pen Live this past week, he is the CEO of the Alliance of Pharmacy Compounding. He pointed out that Eli Lilly actually did the same thing back in August of this year. They are going after sort of both of these pharmaceutical companies, sort of going after alternative routes to shut down the compounded versions. Eli Lilly saying something very similar, that compound pharmacies and the sources that produce their API do not have the same ability to produce Tirzepatide safely, like Eli Lilly does. So again, I think these are probably long shots on the part of these drug manufacturers, but we've been so focused on the lawsuit between the Outsourcing Facilities Association and the FDA in terms of the shortage list and what allows compounding to take place in the United States, where you've also sort of quietly under the radar seen these pharmaceutical companies go after the safety of legitimately compounded 503B and 503A versions of their medications. And so the landscape is rapidly evolving here. And so accessibility continues to be the number one topic that we cover here at On the Pen, because so many of you in the community rely on the compounded versions to maintain accessibility. I do believe that the changing of the savings card is a step in the right direction by Eli Lilly, dropping that back to $550 to keep it at least somewhat closer, $100 closer. That's a pretty significant amount to the price of the compounded versions. And hopefully we can parlay this information with maybe an increased dosages available of the single dose vials, hopefully around that same price as well. Of course, in a perfect world, we would have this drug much cheaper and much more accessible, but there's a lot of nuance and complexity that goes into that. It's not as simple as just offering a cheaper drug. Can you imagine if tomorrow Eli Lilly said, it's $100 for our medication? We all know they can't keep up with supply now. Imagine everybody had access at $100. You'd never be able to find it. So there is some sort of safeguard in the pricing when it comes to accessibility. Now, I'm not advocating for expensive drugs by any means, but you have to understand that the issue is more complex than just calling for cheaper medications. But we will have to see how this kind of all shakes out. Hopefully more vials, hopefully at a cost that is around where the savings card cost is, hopefully cheaper. But like I said, it's a little bit more nuanced than just asking for cheaper medication. That is the news for this week. I mean, you see essentially Hims and Hers came out today, one of the largest publicly traded telehealth companies, and said they had polled 10,000 people who had started compounded semaglutide and tracking their response to the compounded version versus the branded version. And they were able to show through this data that the compounded versions were safe. Of course, I think there's a little bit more nuance to that as well, rather than just polling 10,000 people and saying, hey, how did you do side effect wise? There are some questions that are very interesting that were raised by Novo Nordisk that I would be interested in seeing more answers to, but certainly their point is well taken, that it's very interesting that people have been on compound semaglutide for a couple of years now, and it seems to be just as safe and effective as the branded version. But I think there are some answers some questions that we should be asking about compounds. And so I think this debate is fascinating. We'll continue to follow it closely here at On the Pen. This is, again, a huge week. We'll be back here with a special edition of On the Pen. The podcast covered the Eli Lilly earnings call. Perhaps we'll have time to cover the Novo Nordisk earnings call in a video as well. And of course, Obesity Week coming up this week. Thank you again to those who have contributed. And thank you to our sponsor, Ro. Ro is the sponsor of the On the Pen podcast. Ro is the telehealth company that I have chosen to work with for my own care. They have a program called Ro Body. Now, the Ro Body program is awesome. 15 to 20% body weight lost on average after a year for those who have engaged the Ro Body program, gotten access to GLP-1 medications and a lifestyle modification program to control their chronic disease of obesity. And Ro does an absolutely great job. It is a seamless and frictionless way to get access to a medical provider who can then provide support in terms of the medications. If you're ever going to look at starting a new medication, of course, it's extremely important to make sure that you are well versed in the potential side effects for that medication. Of course, all that information, safety information, is available at ro.co/OTP. Within a couple clicks there, you can find safety information. You can find more information about the Ro Body program, and let us know how much you appreciate Ro sponsoring On the Pen in the comments of this video. Thank you for watching. Thank you for being the best part of what we do here at On the Pen. Couldn't, wouldn't, shouldn't do it without you. We've got an absolutely amazing week in store for you with Obesity Week coming up. There's going to be just a tremendous amount of content coming out of that, and I cannot wait to bring it all to you. I'm hoping that I can stay healthy. There's a little bit of junk going around here, so I'm hoping that I can stay healthy for that, and very, very excited to bring that to you starting this upcoming weekend, Obesity Week. Thank you again to those who have donated and helped to defray some of the cost of us getting down there to bring that to you. And yeah, can't wait to bring it to you. So have a great week, and we'll catch you on the next one. Have a great week. Thanks so much.